head injury is serious enough to be despair of, and no head injury is minor to be neglected. These were described by Hippocrates in 400 BC. It still stands true today. Brigadier Professor Dr. P.K. Sahoo, Chief Consultant, Neuro Spine Radiosurgery. As common people understand, head injury is the injury to the cranium and its contents. Cranium is the skull bone and the contents are the brain vessels, the glands, the nerves and the coverings. But as per World Health Organization, head injury is the injury following injury if there is loss of consciousness, if there is deterioration of level of consciousness, if there is any fracture skull on X-ray, or if there are clot on the head scan, it will suggest that the individual has sustained head injury or traumatic brain injury. The traumatic brain injury can be minor, which is called as concussion, which occurs in 80 to 90% of the people of head injury, and 10% may be severe head injury. This severe head injury can be detected even by paramedics at the site of accident by knowing a score known as Glasgow-Coma score. Glasgow-Coma score was devised in 1974 and this still stands today. And if the score is 15 and from 15 to 13, that's mild head injury. The score is 9 to 12, that is moderate head injury. And the score is between 5 to 8, this is severe head injury. There is no scoring below 3. So the Glasgow-Coma scale, the maximum score is 15 and the minimum score is 3. And we can detect whether the head injury is minor or trivial or concussion without even doing a single investigation. It is a clinical decision and the treatment can be started from the beginning at the site of accident to en route and to in the hospital by doing the Glasgow-Coma scale scoring. This is a very good score which can be understood by the paramedics, the nurses, even the common man on the roadside should understand because we are having large number of head injury deaths. Last year, in spite of having COVID and a lot of restriction, the total death has been almost 15,000. In the state of Orissa, it has been 2,000. So there are almost 150,000 deaths per year and almost 1/10 of that per month. Minor head injury, as I said, constitute almost 75 to 80%, which we call as cerebral concussion. In a cerebral concussion, what happens? If a person sustains head injury, there will be transient loss of consciousness, there may be vomiting, there may be headache, there may be seizures. All these features might be there. What is important to know is that there will be transient loss of consciousness or there will be deterioration of level of consciousness. The initial score, what I said, will be less than 15, but over a period of time, you will find the consciousness fully becomes normal and the individual recovers fully. There should not be any associated injury. In a cerebral concussion, basically, there is no associated injury. If there is associated injury which leads to loss of blood and hypovolemia, if there is some respiratory distress, there will be problem. So therefore, these cases, when they come to the emergency rooms, as a doctor, we evaluate them, we assess them with the Glasgow-Coma score. We have to do a CT scan to rule out if there is any CT scan, a head injury or not, if there is clot or not. And thereafter, we give them minimum treatment that if you have severe headache, intense vomiting, if there is seizures, if there is fever, if there is altered level of consciousness, in this situation, after 24 hours when you discharge them home, they should come back if these features appear, which suggests that there could be development of hematoma post-surgery subsequently, or there could be some other pathology for which the individual has deteriorated. Therefore, as we must know all about this cerebral concussion, which is minor, which recovers, one should not panic. Even such cases can be handled at the CSE district or in the sub-regional hospital level where even CT scan facility is not available. But if the patient deteriorates, if the score becomes less than 12, if the individual has severe headache, loss of consciousness, vomiting, high fever, seizure, in such situations he has to be referred to a center where facility for neurosurgical intervention and CT scan is available.